How does laser eye surgery work? In 1948, Spanish ophthalmologist José Ignacio Barrique Molina was fed up with glasses. He wanted a solution for blurry vision that fixed the eye itself, without relying on external aids. But the surgery he eventually devised was not for the faint of heart. Barrique began by slicing off the front of patient's cornea and dunking it in the liquid nitrogen. Using a miniature lathe, he ground the frozen cornea into the precise shape necessary for focus the patient's vision. Then he thawed the disc and sewed it back on. Barrique called this procedure keratomalysis, from the Greek word for carving and cornea, and though might sound greasy, his technique produced reliable results. So, how does Barrique surgery work? Keratomalysis corrects what are called refractive errors, imperfection in the way the eye focuses incoming light. Ideally, the cornea and lens work together to focus light on the surface of the retina, but several kinds of refractive errors can impair this delicate system. In people with myopia or short-sightedness, the stiff cornea focuses the light just short of the retina. Those with hyperopia or farsightedness have an opposite problem. Light is focused too far beyond the retina. And in people with the cornea has two different curvatures, which focus light at the two distances and produce blurry vision. Even though with perfect vision will eventually suffering from presbyopia or aging eyes. As the protein in the lens ages, they slowly increase its size. By adults mid-40s, the lens is too large to easily change the shape and shift the focus. Glasses and contact lenses bend light to compensate for these refractive errors. But as Barrique's procedure shows, we can also alter the shape of the cornea itself, moving the focal point backwards, forwards, or pulling a divided image together. And thankfully, modern eye surgery can sculpt the cornea with far less invasive tools. In corrective laser eye surgery, surgeons rely on external lasers. These tools are accurate enough to etch words into a human hair. To safely accomplish these ultra-fine incisions, they use a technique called photoablation. This allows laser to essentially evaporate organic tissue without overheating surrounding eye tissue. So how does laser eye surgery actually work? The first step is to separate a thin layer from the front of cornea. This can be done with a flat wide blade or a femtosecond laser that produces millions of tiny plasma bubbles to create a plane beneath the cornea surface. Surgeons then lift the flat to expose the inside of the cornea. Guided by repressed air and the shape of the cornea, the external laser robotically sculpts the exposed cornea bed into the correct shape. This process usually takes less than 30 seconds for each eye. Finally, the flat is closed, and its acids receive themselves in just a few hours. Because lasering is done on the eyeball itself, it's described as in situ or on-site. Its complete name is laser in situ keratomalysis, but you probably know it as LASIK. Essentially, this technique carved a patient's contact lens prescription onto their cornea. Like any surgical procedure, LASIK comes with 13 risks. Some patients experience slight blurry vision that can't be corrected by glasses, but the technique is currently about as likely to damage your eyes as wearing daily disposable contact lenses for 1 year. Today, a technique called SMILE enables surgeons to sculpt the cornea through the even smaller incisions, further reducing recovery time, and later are just correcting the 3 types of refractive errors. This technology can also restore aging eyes. In a technique called laser blended vision, surgeons adjust one eye to be slightly better at distance vision and the other to be better at close range vision. The difference between two eyes is small enough that most patients can merge their vision, allowing both eyes to work together at all distances. Advances in later technology continue to make the vision correction surgery more effective and accessible. One day soon, Buddha's clear vision of the world without glasses may finally come true. One more. In 1948, Spanish ophthalmologist Barquer Moreno was fed with glasses. He wanted a solution for blurry vision that fixed the eyes itself, without relying on external aid. But the surgery he eventually devised was not for the faint of heart. Barquer began by sliding off the front of the patient's cornea and dunking it in liquid nitrogen. Using a miniature lathe, he ground the frozen cornea into the precise shape necessary to focus the patient's vision. Then he thawed the disc and sewed it back on. Barquer called this procedure keratomalusis from the Greek word for carving and cornea, and with my son's Gretzky, his technique produced reliable result. So, how does Barquer surgery work? Keratomalusis corrects what is called refractive errors, imperfection in the way the eye is focusing incoming light. Ideally, the cornea and lens work together to focus light onto the surface of the retina, but several kinds of refractive errors can impair this delicate system. In people with myopia or short-sightedness, the shape cornea focuses light just short of the retina. Those with hypoturia or farsightedness have the opposite problem, light is focused too far beyond the retina. And in people with astigmatism, the cornea has the two different curvature, which focus light at two distances and produce blurry vision. Even though with perfect vision, we're eventually suffering from presbyopia or aging eyes. As the protein in the lens ages, they slowly increase its size. By adult mid-40, the lens is too large to easily change shape and shift focus. Glasses and contact lenses bend light to compensate for these refractive errors. But as Barquer's precision shows, we can also alter the shape of the cornea itself, moving the focal point backwards, forwards, or pulling a divided image together. And thankfully, modern eye surgeons can sculpt the cornea with far less invasive tools. In corrective laser eye surgery, surgeons rely on excimer lasers. These tools are accurate enough to etch words into the human hair. To safely accomplish these ultra-fine incisions, they use the technique called photolabelation. This allows the laser to essentially evaporate the organic tissue without overheating surrounding eye tissue. So how does laser eye surgery actually work? The first step is to separate the thin layer from the front of cornea. This can be done with either flat white blade or a femtosecond laser that processes millions of tiny plasma bubbles to create a plane beneath the cornea surface. Surgeons then lift the flat to expose the inside of the cornea. Guided by the refractive error and the shape of the cornea, the excimer laser robotically sculpts the exposed cornea bed into the correct shape. This process usually takes less than 30 seconds for each eye. Finally, the flat is closed, and its edges resume themselves in just a few hours. Because lasering is not on the eyeball itself, it is described as in situ or on-site. Its complete name is laser in situ keratomalysis, but you probably know it as LASIK. Essentially, this technique helps a patient's contact lens projection onto their cornea. Like in surgical procedure, LASIK comes with certain risks. Some patients experience a slight blurry vision that can't be corrected by glasses. But the technique is currently about to likely damage your eyes, as wearing daily disposable contact lenses for 1 year. Today, a technique called SMILE enables the surgeon to sculpt the cornea through the even smaller incision. For the reduced recovery time, and laser are just corrected the three types of refractive errors. This technology can also restore aging eyes. In a technique called laser blinded vision, surgeons adjust one eye to be slightly better at distance vision and the other to be better at close range vision. The difference between two eyes is smaller enough that most patients can merge their vision, allowing both eyes to work together at all distances. Advances in laser technology continue to make vision correctly surgery more effective and accessible. One day soon, body care's vision of a world without glasses may finally come true.